Hello dear all. In this presentation we discuss features of tubercular miasm. How you will find the features of tubercular miasm in the patient. How to assess it clinically. Okay. So what is tubercular miasm? It is called by Dr. Allen as pseudosora. That is, it is having the nature of soric miasm, but it is not sora. Rather, Dr. Roberts called it as sora and syphilis. That is, tubercular miasm is a combination of sora and syphilitic miasm. It is also called as heightened sora. So, general features of tubercular miasm, let's understand. Tubercular miasm, the name is given by Dr. J. H. Allen. What is tubercular miasm? It is the combination of sora and syphilis miasm. So, this is some features of soric miasm and some features of syphilitic miasm. The most important, the structural changes you will find of syphilitic miasm. In the patient, you may get history of tuberculosis in the past. Presence of tubercular diathesis. What is tubercular diathesis? It is nothing but diathesis is tendency to suffer from disease. So it is nothing but a stage in between health and disease. So tubercular diathesis means what? Patient who are tall, lean, thin, they have hypersensitivity allergies, they have fair long eyelashes, erraticity of complaints and fast progress of complaints. So tendency may present in the patients, and these patients also present with hypersensitivity or allergies. They are tall, lean, thin people, have fair long eyelashes. There is erraticity of complaints, and of course the disease progresses very fast. So you will have pneumonia in the first 2 days. So fast progress of disease. This is tubercular miasm. Any disease progresses very fast is tubercular miasm. And how phosphorus patient we describe, tall, lean, thin, fair, long eyelashes, he represents tubercular miasm. Ailments from, what is the causation in tubercular miasm? Let's understand. It is ailments from cold weather, ailments from wet weather, ailments from change of weather. Also suppression of discharges, removal of tonsils. So this is also suppression, and problems of dentition. So this represents tubercular miasm, that changes in the weather aggravates, and rather so many diseases are caused because of change in the weather. Patient is very sensitive to cold weather and wet weather. There is suppression of discharges, removal of organs, problems during dentition. So what is the mind of tubercular miasm? Let's understand. He is short-tempered, also very vivacious, excitable, like phosphorus again. There is extreme desire for traveling. Patient is fastidious. There is anticipatory anxiety. Patient is fearful. He wants company. So tendency to take colds. So this represents a very important physical feature of tubercular miasm. So we study tubercular miasm as how we study any remedy, very deep acting constitutional remedy in homeopathic materia medica. Similar way we want to study the miasm also. So we saw what are the causations. In that also we saw further the mental symptoms and then the physical features of tubercular miasm. So tendency to take colds, glandular tendency, enlarged tonsils, enlarged cervical glands. So in a patient, he will complain that even if I get some tooth infection, first is I get the glands. There is swelling and pain in the glands. So glandular tendency very marked in tubercular miasm. Hemorrhagic tendency, that is bright red blood. Tall, lean, thin, long eyelashes, long hands and long legs are the features of tubercular miasm as you find in phosphorus. So phosphorus represents the tubercular miasm. Patient is stooped shoulder, tendency to respiratory complaints, white spots on nails, bitter nails and split nails, feature of tubercular miasm. Tendency to abscesses, blood and pus is classical tubercular miasm. So in the patient you will find these symptoms. Most important is a hemorrhagic tendency and blood is bright red in color as you find again like in phosphorus. So what are further physical features of tubercular miasm? Craving for cold drinks, cold food and ice cream. Craving for chocolates, smoky food, salt and liquor. Craving for jelly, cold food, spicy food, pungent food and also fried food. This represents tubercular miasm. Craving for pica. Pica, that is indigestible things. Rapid progress of disease pathology. Very important feature in tubercular miasm. Pathology progresses very fast. Aversion to meat. So these are the physical features you will find in patients which you can identify as features of tubercular miasm. Sphere of action in tubercular miasm is respiratory system. So most important is recurrent tendency to catch cold. Affection of heart, so action on circulatory system. Hemorrhage, so blood is bright red in color. GIT, patient has ravenous appetite. Action on nails, they are brittle, they break easily, they are split nails. Skin, you will find fissures, fistula, cracks, suppuration and abscesses. There is weakness, lack of vitality. So patient always complains they are having weakness, Very important feature in tubercular miasm. Fatigued easily. So chest symptoms, patient is tall, lean, thin, history of tuberculosis. They all represent tubercular miasm. How is the tubercular child? He is usually called as a problem child. The child is plump with silky eyelashes, blue eyes. He sweats on head. There is a problem during dentition. Enlarged cervical glands, tonsils and adenoids. Ailments from cold weather, so tendency to catch cold very easily. Comprehension is slow and dull. Child cries during sleep. Weak joints of wrist and ankle. Child cannot hold the things, he drops the things. Clumsy in walking, so he stumbles often. He stays alone, there are stomach upsets, boils on head, impetigo, that is skin infections, again having tendency for abscesses and boils. So child who is crying in the sleep, faces red spots on the cheeks, sweat on face, cracks on lips, swelling on face. Nose, patient has epistaxis, he has coryza, offensive odor. Throat pain, tonsils, painful, enlarged, aggravations following. If you go to ears, you will find suppurations, otitis media. So here action on the nose, ears, throat. In mouth, you will find offensive odor, ropey saliva. This child having craving for salt and pica, very hungry, ravenous hunger, hemorrhage from anus with hemorrhoids, and also there is epistaxis. So narrow chest, cough at night, offensive odor, breathlessness on climbing stairs, bones affection, periosteal affections, affection of skin causing suppuration. So all these features you will find in the patient. Features of tubercular miasm you will find the most important you can identify is hypersensitivity, reactivity, allergies, erratic behavior. Patient is very much normal and within 1 hour he will develop 102 fever. Can't predict. Even the reactions of mind, suddenly getting angry, you don't know the cause the patient is getting angry. Glandular tendency, affection of which organs? Liver, kidney, pancreas, lymph nodes, hemorrhage, bright red blood from all orifices, affection most important of respiratory system, sudden eye fever. These all are the very important features of tubercular miasm you find in patient very often. Thank you.